The spine is one of the most important parts of the body. Not only does the spine protect your spinal cord, but also serves as a foundation for your bone structure. Statistics show 3% of the population suffers from a disease called scoliosis. Scoliosis is a curvature and a rotational deformity of the spine. Not only can this condition cause a tremendous amount of pain, but in some cases progress to the point of fatality. Scoliosis is a progressive disease that, if not treated, can get worse over time.
Scoliosis is just a general term that means curvature of the spine. Just like we drive a car, but there are many types of cars, well, there are many types of scoliosis. As the scoliosis develops and progresses, it has three components. It's got a sideways curve in the spine, causes a rotary problem in the spine, which causes the rib hump that we're familiar with in seeing the patients with scoliosis. Well, the key to early treatment is early diagnosis. And that usually begins in the primary care physician's office and doing something called an Adams forward bend test and just looking for lack of symmetry of the back.
Today, we are privileged to learn about a medical procedure at Nicklaus Children's Hospital that's given children a brighter future. Dr. Shufflebarger, a worldwide expert in spinal deformity care, is changing lives one child at a time with state-of-the-art orthopedic procedures that's combating the effects of scoliosis.
The treatment choices for scoliosis, in my view, are really only three, and that's watching it, which is really doing nothing, surgery, which is reserved for more severe cases, and bracing. And bracing is indicated for small to moderate-sized curves in children who are growing, with the goal to prevent it from getting worse. So bracing has been shown to change the natural history, or what happens to the untreated curves, about 2/3 of the time, and that being to keep it from getting worse. It's not a corrective factor. Nothing else, exercises, manipulation, and anything you can imagine has been tried, but there's no scientific evidence that anything else will change the natural history.
During our visit with Dr. Shufflebarger, we learned that families should know the options they have when making a decision on an orthopedic surgery for their children. There are several surgical choices and options to consider. Dr. Shufflebarger makes these recommendations specific for each child and explains safety factors on how he feels each patient can be served best.
Scoliosis surgery is a major undertaking, particularly for the family and the patient. And we approach spinal surgery as a team event. And the team consists of the surgeon and his assistants, the anesthesiologist, who should have some expertise in anesthesia for scoliosis surgery, which is different than anesthesia for a lot of other things. The spinal cord monitoring team should be led by a physician and have a good relationship with both the surgeon and the anesthesiologist. And finally, the nursing team in the operating room we feel should be consistent and the same, so the procedure goes seamlessly.
In addition to Dr. Shufflebarger, the hospital has an incredible staff of doctors and nurses that oversee every procedure and care for every patient that's treated in orthopedic surgery. This comprehensive staff of doctors and nurses are responsible for performing over 1,400 orthopedic surgeries every year. Each doctor and staff member in orthopedic care play a huge role in the success of every patient's outcome.
This is a big surgery, okay, and to expect the parents to do this on their own just would not be realistic. So having the nurses that are on the floor, the physical therapists, the child life therapists, really provides them that initial help so that they feel that this is something that they can handle once they get home. Families know how to contact either by phone or for email, and I think it helps to lower their stress so that just the simplest question, they know that they have someone to contact. And patients that have had surgery 6 months, 1 year, more than that, will still contact me with the occasional question, oh, I was wondering, is this normal? Is she allowed to do this? Oh, look, she had a competition. It's a very good relationship.
When we spoke with the parents and the patients, we found this to be the most touching part of our visit. The orthopedic procedure has a life-changing impact on each patient, in which the deformity is corrected and will not progress.
When we first found out about the procedure and everything and having to go into surgery, I did a little bit of research on Dr. Shufflebarger and finding out that he's been doing this type of procedure for so long. He's also authored books, and just that alone right there gave me the confidence in knowing that she was going to be in the best hands. As a father, and being that Haley is, a physical child, she's in dance and everything. For me, there was some concern in the beginning. However, finding out how it's such a standard operating procedure and everything went well and smoothly, I don't really have any concerns as far as the recovery, and I'm quite confident in the recovery and that she'll be back to normal as soon as possible.
This gives each patient the opportunity to live a normal life and has a huge effect on their self-esteem. Parents have joy and peace knowing this surgery has completely changed their child's life.